our healthcare acknowledges the traditional custodians of the country throughout Australia and their connections to the land, sea, and community. We pay our respect to their elders, past and present, and extend that respect to all Aboriginal and Torres Strait Islander people today. So on today's agenda, we're going to talk about what a fall actually is and some of the statistics and facts around falls in Australia. So what is a fall? A fall happens when someone accidentally ends up on the ground or a lower level. And what we mean by a lower level is to say that if you fall after getting up from the couch or walking past and trip over something and you manage to land on the furniture as opposed to the floor, that would still count as a fall. Studies show that falls are the leading cause of unintentional injury in older Australians. Falls cause 77% of injury hospitalizations among those aged 65 and older. Older Australians were 8 times as likely to be hospitalised and 68 times as likely to die from a fall than those aged 15 to 64. Falls can result in a loss of independence and fear of falling, which can both lead to restricting or limiting activities of everyday life or partaking in things that we enjoy. However, luckily evidence suggests that falls can be prevented. There are multiple studies that show that interventions can reduce falls among older adults living in their own home. So talking about the risk factors now. A risk factor is something that increases a person's chance of falling. Risk factors are relating to health, activities, and surroundings, and they can all contribute to a fall. Some of these risk factors are changeable or modifiable, meaning we can take actions to reduce them, while some are non-modifiable, meaning we really can't change them, such as advancing age. Falls are usually caused by an interaction of a number of risk factors. The more risk factors you have, the greater the risk of falling. Falls prevention is about recognizing and, where possible, taking action to reduce the risk. It is advised that all falls are discussed, even the ones that didn't cause an injury, discussed with your general practitioner or other healthcare providers, and this is to help identify and address these risk factors. And overall, this is to help you reduce the chance of having another fall. So on the screen there, these are some of the risk factors associated with falls in no particular order. So fear of falls can increase your chance of having a fall. And while we will talk about this in more depth later as a modifiable factor, meaning that we can take action and reduce it. However, what tends to happen when someone has a fall is they become anxious and fearful of falling again. So they reduce their activity, and this results in decreased balance and mobility, which in turn increases the risk of falling. Mobility, balance, and strength limitations are also, mobility, balance, and strength limitations. These are obvious about if you're not steady on your feet, you have a more chance of having a fall. Talking about incontinence, specifically urge incontinence. This can increase your risk also. This may be because you are rushing to get to the bathroom on time, which will cause you to maybe be less cautious than what you perhaps normally would be, and that can result in a fall. Environmental hazards, such as a lack of appropriate lighting or clutter. Vision impairments, that's a risk as it may impact your ability to see, and therefore you might not be able to avoid those potential trip hazards. Impaired cognition, such as dementia, where the individual may have impaired judgment, and not such as not using your walking frame to go to the bathroom or not turning the light on when you needed to go at night. Advancing age is another big one. So the older that you get, the more likely that we are to fall. Foot pain can change the way we walk, and that can make us unsteady. Poor foot health, like peripheral neuropathies or changes in the sensation in your feet, or even inappropriate footwear, such as wearing shoes that aren't well fitting, can all be risk factors. Having health conditions like Parkinson's disease or arthritis or a history of a stroke equal risk factors. Some medications that can have side effects. Some of these can be feeling drowsy or feeling confused, and therefore you might be more likely to have a fall. Again, speaking to the history of a fall, if you've had one in the past, then there is a substantial risk factor for having another in the future. Dizziness, so another significant risk factor for falling, as it can be disorientating and you can have a loss of balance. So today I hope to help to educate you on some of the ways that you can be able to prevent yourself from falling or others you know. And this is by providing you with some strategies to help address some of the changeable risk factors like we've just discussed. So exercise and reducing falls. Excuse me, that's my lunch. Researchers found that exercise can play a really crucial role in falls prevention. Studies show that even older adults can improve their strength and balance to achieve stability and avoid falls. In order to reduce falls, we need to be doing balance exercises. So this is where a physio like myself can come in, and this can be particularly helpful as in order to use exercise, it needs to be effective and challenging, but safe. So as a physio, I can assess and therefore prescribe an appropriate exercise level, and we can use that to, with assistance, ensure you remain safe and steady while you're doing the exercise. On the screen, the picture on the right is with the 4 pairs of feet, and that's in different positions. That's an example of the type of exercises we can do to work on balance. So the first one on the left with the feet apart is the easiest. Thanks for Nicole for using your pointer there. And on the right, it progresses to the hardest out of the 4. Yeah, so you can practice these at home, and I'd recommend doing so in front of the kitchen bench so that you've got something sturdy to hold on to, or if needed, have a family member or carer close by so that they can help steady you if needed. I'd recommend starting with the exercise on the left, so the easiest level, and try and go for up to about 30 seconds. And if you can do that quite easily, then moving on to the next one. The other type of exercise that is beneficial is beneficial for falls prevention is functional exercise. So this is a fancy way of saying that exercise that's similar to activities that we're likely to do every day. Things like standing up and sitting down, like the picture on the bottom right. Yeah, sorry, thanks, Nicole. Walking back, walking sideways, holding onto the bench, like we might do in the kitchen, or even marching on the spot. For the exercise to be most effective, we ideally would like to see up to about 2 hours a week for 6 months. However, ongoing exercise is likely the best way to prevent falls. Poor adherence to exercise programs is also one of the reasons that an exercise program might not be as effective. Exercise programs that likely reduce falls include multiple different types of exercise, typically balance and functional exercises plus resistance exercises. And I believe we'll speak to that a little bit further and when we come to our chair exercises. So exercise in reducing falls. Studies found that Tai Chi, just onto the next slide, I believe, Nicole. Thank you. So studies found that Tai Chi can also prevent falls. Often communities will have Tai Chi classes you can attend at libraries or town halls in your local community. It's worth noting that it's unlikely that resistance exercise like dance or walking alone will prevent falls. So as per the previous slide, we really want to be focusing on balance and functional exercise to help reduce the falls. Talking about doing multiple things, not just one. So speaking to the fear of falls now, unfortunately, what can happen is we end up in this cycle, as you can see on the screen, where we will have a fall and we may or may not hurt ourselves, but it gives us a bit of a fright. So we become fearful of having another fall, and as a result, we might decrease our activities. You might decide to stop walking to the letterbox, for example. This can lead to a decreased physical ability. So your balance, strength, and walking might all deteriorate slowly, which leads to an increased risk of falling, and which can result in another fall, and then you get stuck in this loop. Speaking to chair exercises, as I mentioned just before, the good news is that we can do something about this cycle. For individuals with an especially high fear of falling, or those who are limited with mobility, chair-based exercises are recommended. Chair-based aerobic exercises or exercise that increases your heart rate and breathing has shown to significantly decrease the risk and decrease the fear of falling. Chair-based exercise with a focus on strength has been shown to improve function. Here on your screen are some examples of chair-based exercises you can try at home. And we've also got a copy of this on our website, and if you need a link to it, please let us know. Speaking to walking aids now, such as walking around your home confidently, walking to the letterbox, or walking out in the community, it's important to know that not everyone needs a walking aid. And as a physio, my aim is to provide you with a walking aid that would help increase your mobility with the least amount of equipment or support as possible. Many different types of walking aids are for different needs. So what is suitable for your friend or your neighbor might not be the best fit for you. If you have got a walking aid and you want to ensure it's in good working order for optimal use, so that it's beneficial to check and make sure that it's safe and everything is working well, like brakes, for example, on a wheeled walker. This makes sure that, so making sure the tips on the bottom of walking sticks is another example, making sure they're not worn down and they're nice and round to provide appropriate support. We also want to make sure that the equipment is set to the correct height. Too low and you'll be bending forwards or stooped over, and too high you can hitch up your shoulders, which can be sore. Talking about the home environment now, there are certain hazards in the home environment that can increase your risk of having a fall, such as poor lighting or clutter. But there's evidence to show that a home safety assessment and modifications, particularly when done by an occupational therapist, can help reduce falls. So through research, we know that this is particularly true for those at higher risk of falling, including those who have severe visual impairments. And OT's role is not only to assess potential hazards within your home, but also to assess patients' physical and cognitive abilities, particularly around those of daily living, such as getting in or out of the shower, getting dressed, and meal preparation. And based on their assessment, they can recommend home mods, such as an installation of handrails in bathrooms or toilets, or even stairs, and other pieces of activity modifying equipment that will likely be beneficial in maintaining function, independence, and safety. So here are some quick home environment tips. And these few tips are to reduce hazards in the home environment. They're easily addressed, and so they don't necessarily require an OT input to achieve. So just reading across here, so thinking about removing power cords from common walking areas as you could trip over them, using non-slip mats in wet areas to provide a bit more friction to your feet, placing high-use items in easy-to-reach places so that you don't have to reach out of your comfort zone. Removing faulty furniture. If that chair that's got a broken leg is still in use, then maybe it's time to throw it out. Removal of clutter, considering increasing the lighting in dark areas or even using night lights in the hallway to help you with your vision if you needed to go to the toilet at night. Removing or taping down floor rugs is another easy step, as well as installing things like grip strips on outdoor steps to provide extra traction. So speaking to poor vision now, studies show that impairment of visual functions such as visual acuity, contrast sensitivity, visual fields, and depth perception are all associated as an increased risk of falls. Therefore, to aid in falls reduction, it's recommended that you have your vision assessed regularly. Early detection can improve eye health and reduce avoidable blindness, as 75% of eye conditions are preventable or treatable. Bifocal or multifocal lenses can make it harder to judge the distance and position of curbs and steps. So consider using a pair of single lens glasses for walking, and just do take care when using steps. Keeping your house well lit, especially at the stairs, and turning on the lights before entering dark rooms helps with vision. Taking extra care when prescribed with new glasses, as the new visual information to your eyes can be slightly disorientating and can take a moment for your brain and movements to adjust. So wearing your prescribed glasses for their intended purpose, for example, reading glasses for reading and distance glasses are for walking around. Speaking to medication now, some medications can increase the risk of falling, and this can be due to medication interaction, unwanted side effects, and even desired effects of medications, such as a sleeping tablet, could make you feel drowsy. Therefore, it's recommended that you have your medication reviewed by your doctor regularly, including any over-the-counter medication or supplements that you might be taking as well. It's important to discuss side effects like feeling dizzy, drowsy, or confused with your doctor as well. Speaking to our feet and foot health now, this can change the way that we walk or stand, and this can affect our balance. It's a multifaceted approach, and that means that it's more than just your podiatry care, which may be involved with cutting your toenails. So it may include ankle and foot exercises, and doing a wear assessment on the soles of your shoes as well. Some shoes or slippers can also make your feet more likely to slip, trip, or fumble, leading to a fall. So this highlights the importance of specific design features for preventing falls among older adults. So talking about the fit now of your shoes. So properly fitting shoes are crucial to ensure correct fit in both length and across the toes. Loose or tight footwear can cause instability or discomfort. And often when I see patients in slippers, which may have been the correct fit at one point, they can get worn out and they might be a bit too loose now. So if possible, it might be an idea to replace those. So overall, today's talking main points to take away. Evidence suggests that falls can be prevented. Falls prevention is about recognizing where possible taking action to reduce the risk of falls. It's important to discuss all falls, including those that didn't cause an injury, with your and talking about these with your GP or another healthcare provider. I think the next slide might be talking about some upcoming seminars. Yeah, so next week we've got another talk that will take place, and that's going to be on a different topic, and that's palliative care and enhancing the end-of-life quality. And then following in October, in the next month, there'll be some more info about podiatry. These talks are a little bit more in-depth, so yeah, if you're interested, then get in touch with us. Now's your time for any questions, and I'll have a look and see if there's any in our chat area here. Okay. So someone's asked if physio can be delivered via telehealth. Now, I might have to hand over to my colleague Nicole here, but I am aware that Empower has rolled out some telehealth. But yeah, perhaps Nicole, you could speak to that?
Yes, we do. We do deliver dietetics, OT, and physio via telehealth. So that's really handy for people in regional remote areas as well. And if you prefer to have your appointments at home, then yeah, they're really effective. So, I mean, it doesn't ever replace one-on-one, but it's still very effective, and we do often say that you should have a carer or a family member with you as well, so you can help not only navigate the IT, but to help support you, as with the other exercises that Simon went through. Yeah, to have someone with you to support.
Thanks, Nicole. Some other questions here. One's asking if feet circulation booster machines really help. Now, I might not be thinking of the same machine that you're speaking to, but I would ultimately need to go and revise on the latest research about feet circulation boosters. I guess it would depend on how much sensation is in your feet. If peripheral neuropathy is your issue, for example, then yeah, could be difficult. Yeah, you've got me there. I'll have to go and reach out and do a bit more research on that one. The last question I've got here is asking how long do walking aid prescriptions last? And that's an excellent question. From a few of my clients, some of them might stay with the same walking aid for a really long time, and look at only replacing things like the tip on a on the base of the walking stick. Oh, I've got no hair. That's lovely. So he's been distracted. I'm an egghead.
If you tilt your head forward, we can see your lovely hair. There
That's
you
all
go.
right. It's fine. It's what I look like bald now.
Yeah.
Yeah. So really, a change in walking aid might come from if there's been quite a functional decline. For example, if you've had a recent fall, or you're really just feeling a lot more unsteady than you had before a fall, then you might link in with your physio to look at changing your walking aid, and maybe that's talking about going from a walking stick. And whilst they're great, they don't offer as much support as something like a walking frame. And if that's what you need to stay active and stay mobile and do what you really enjoy in your community, then it might be time to consider looking at a more supportive aid like a walking frame. I think we've got another question here now. So, do you help with get-to-go CHP? I'm not sure. Nicole, I'm not sure if you can also see questions here, but I think this is a little bit more
Yes,
Um,
I'm not too sure. I could ask, I've got an OT here. Um, do we help with Geek to Go CHIS referral codes in order for equipment? Yes, we do. So we've got one of our OTs here as well. So yeah, we can. And if so, what's the charge rate? Do we know that? Right, it'd be our CHISP hourly rate. We're not too sure what that is off the top of our head, but we can look into it, Banal, and email you. You can raise your hand if you'd like to talk as well. If anyone's having trouble typing in the question, but I hope that helped.
yeah, overall, thanks for the questions, everyone, and thanks for tuning in. I'm sorry to provide definitely an answer that could have a little bit more with regards to your circulation booster machine. Yeah, you've prompted me to do a little bit more research in that area, so thank you for that. Yeah, do reach out to your healthcare provider if you've had any falls and of late and need to have a bit more support. But otherwise, thanks for coming along. Have a great rest of your afternoon wherever you are, and yeah, stay safe.
Thanks, Simon. That was great.
Thanks, Nicole.
Thanks everyone for coming.